Eradicate poverty. Second. Stabilize population. C7. Bottom line highlights. 2 children per couple. Universal basic education. Teacher training. Scholarships. Focus on girls. Adult literacy. School lunch program. Global WIC, women, infants, children. Stabilize population at 8 billion by 2041. Universally available family planning. TV, radio as tools. Dry compost toilets. Oral rehydration. Reduce cigarette smoking. Protect non-smokers. Condoms. AIDS medications. Reduce developed world farm subsidies. Reduce developing world debt. Smaller families brings generous economic dividends. Bangladesh. Analysts concluded that $62 spent by the government to prevent an unwanted birth saved $615 in expenditures on other social services, a 900%, tenfold return. Reproductive health and family planning services leaves more fiscal resources per child for education and healthcare, thus accelerating the escape from poverty $7.9 billion gap. Economic benefits of healthcare. Village-level clinic would yield enormous economic benefits for developing countries and for the world as a whole. Providing basic universal health care in developing countries will require donor grants totaling $27 billion in 2007, scaled up to $38 billion in 2015, or an average of $33 billion per year. In addition to basic services, this $33 billion includes funding for the Global Fund to fight AIDS, tuberculosis, and malaria and 4 universal childhood vaccinations. Condoms. Dealing with the HIV threat requires roughly 13.1 billion condoms a year in the developing world and Eastern Europe. Including those needed for contraception adds another 4.4 billion. But of the 17.5 billion condoms needed, only 1.8 billion are being distributed, leaving a shortfall of 15.7 billion. At only 3.5 C each, or $550 million, the cost of saved lives by supplying condoms is minuscule. If we assume that logistics, training, education, etc. costs are 6 times the price of the condoms themselves, filling this gap would still cost only $3 billion. AIDS financial resources and medical. Severely limited compared with the need. 4.6 million people who exhibited symptoms of AIDS in sub-Saharan Africa in 2006. Just over 1 million were receiving the antiretroviral drug treatment that is widely available in industrial countries. Just 25%, a 75% shortfall. Deathfall. The prospect of treatment encourages people to get tested for HIV and raises awareness and understanding of the disease and how it is transmitted. Steps needed to eradicate poverty. Accelerate the shift to smaller families. Filling several funding gaps. Reach universal primary education. Fight infectious diseases such as AIDS, tuberculosis, and malaria. Provide reproductive health care. Contain the HIV epidemic. The initiatives discussed in this chapter are estimated to cost another $77 billion a year. Steps needed to eradicate poverty. Heaviest investments in this effort center on education and health, cornerstones of both human capital development and population stabilization. Education, universal primary education and a global campaign to eradicate adult illiteracy. Healthcare includes the basic interventions to control infectious diseases, beginning with childhood vaccinations. Brown's more detailed presentation. Chapter 7 Eradicating Poverty. Second. Stabilizing population. Eradicating poverty. Second. Stabilizing population. C7. Cutting the number of people in poverty in half by 2015. Two big possibilities for this: China and India. China's annual economic growth of nearly 10% over the last 2 decades from 648 million in poverty in 1981 to 218 million in 2001. India's more recent acceleration in economic growth to 7% a year together lifted millions out of poverty. Sub-Saharan, 800 million people sliding deeper into poverty. Hunger, illiteracy, and disease are on the march. The failing states as a group are also backsliding. Extreme poverty in these countries is over 50% higher than in 1990. Other Millennial Development Goals, MDGs, include reducing the ranks of those who are hungry by half, achieving universal primary school education, halving the number of people without access to safe drinking water, reversing the spread of infectious diseases, especially HIV and malaria, reducing maternal mortality by 3/4, and reducing under 5 child mortality by 2/3. Goal 4: halving the number of hungry, not being achieved. Long-term decline in the number of those who are hungry and malnourished has been reversed. The MDGs are difficult or impossible to achieve with current levels of population growth in the least developed countries and regions. Need for a substantial increase for support in national family planning, particularly for the 2 billion people currently living on less than $2 per day. United Nations has since approved a new target that calls for universal access to reproductive health care by 2015. 2 children per couple. There is no feasible alternative. Any population that increases or decreases continually over the long term is not sustainable. Treat poverty and population for what they are: national security issues. Slowing population growth helps eradicate poverty and its distressing symptoms. Eradicating poverty helps slow population growth. With time running out, the urgency of moving simultaneously on both fronts is clear. Note: 2011 news articles indicate that the MDGs may be moved out tens of years for achievement. Universal basic education. Narrowing the gap between rich and poor segments of society, ensuring universal education. Make sure that the 72 million children not enrolled in school are able to attend. Children without any formal education almost ensures they will remain in abject poverty. This widening gap itself becomes a source of instability. Illiteracy and innumeracy are a greater threat to humanity than terrorism. Uneven progress. In 2000, some 78% of children were completing primary school, while by 2005 this figure reached 83%. Only 95 of the 152 developing countries for which data are available will reach the goal of universal primary school education by 2015. Poverty is largely inherited. The overwhelming majority of those living in poverty today are the children of people who lived in poverty. Key to breaking out of the culture of poverty is education, particularly the education of girls. As female educational levels rise, fertility falls. And mothers with at least 5 years of school lose fewer infants during childbirth or to early illnesses than their less educated peers do. Basic education tends to increase agricultural productivity. Agricultural extension services that can use printed materials to disseminate information have an obvious advantage. So too do farmers who can read the instructions on a bag of fertilizer. The ability to read instructions on a pesticide container can be life-saving. At a time when HIV is spreading, schools provide the institutional means to educate young people about the risks of infection. Teachers. More teacher training in developing countries, particularly those where the ranks of teachers are being decimated by AIDS. Scholarships for promising students from poor families to attend training institutes in exchange for a commitment to teach for, say, 5 years, could be a highly profitable investment. This would also foster an upwelling of talent from the poorest segments of society, especially poor girls in rural areas. Ethiopia has pioneered this with girls' advisory committees. Representatives of these groups go to the parents who are seeking early marriage for their daughters and encourage them to keep their girls in school. Brazil and Bangladesh among them, actually provide small scholarships for girls or stipends to their parents where needed, thus helping those from poor families get a basic education. 800 million illiterate adults. Severely handicapped adult literacy programs, relying heavily on volunteers. Bangladesh and Iran, both of which have successful adult literacy programs, can serve as models. $10 billion in external funding, beyond what is being spent today, is needed for the world to achieve universal primary education. School lunch program. Effective to get children in school. Children who are ill or hungry miss many days of school. Sick children often face a lifetime of diminished productivity because of interruptions in schooling together with cognitive and physical impairment. When school lunch programs are launched in low-income countries, school enrollment jumps, the children's academic performance goes up, and children spend more years in school. Girls are the key. Drawn to school by the lunch, they stay in school longer, marry later, and have fewer children. Launching school lunch programs in 44 lowest income countries will cost an estimated $6 billion per year beyond what the United Nations is now spending to reduce hunger. Improve nutrition before children even get to school age. Women, Infants, and Children (WIC) program, which offers nutritious food supplements to needy pregnant and nursing mothers, should also be available in the poor countries. Based on 33 years of experience, it is clear that the US WIC program has been enormously successful in improving nutrition, health, and the development of preschool children from low-income families. Should be expanded to reach pregnant women, nursing mothers, and small children in the 44 poorest countries. These efforts, though costly, are not expensive compared with the annual losses in productivity from hunger. Stabilizing population. Some 43 countries now have populations that are either essentially stable or declining slowly. A larger group of countries has reduced fertility to the replacement level or just below. Included in this group are China and the United States. A third group of countries is projected to more than double their populations by 2050, including Ethiopia, the Democratic Republic of the Congo, and Uganda. World population projections. The medium projection, the one most commonly used, has world population reaching 9.2 billion by 2050. The high one reaches 10.8 billion. The low projection, which assumes that the world will quickly move below replacement level fertility to 1.6 children per couple, has population peaking at just under 8 billion in 2041 and then declining. If the goal is to eradicate poverty, hunger, and illiteracy, we have little choice but to strive for the lower projection. Stabilizing at 8 billion by 2041. All women who want to plan their family should have access to the family planning services they need. At present 201 million couples cannot obtain the services they need. Women live in fear of their next pregnancy. They just do not want to get pregnant. Filling the family planning gap may be the most urgent item on the global agenda. The benefits are enormous and the costs are minimal. Family planning. Countries that want to help couples reduce family size can do so quickly. In just one decade, Iran dropped its near record population growth rate to one of the lowest in the developing world. Iran, for example, at war with Iraq between 1980 and 1988, Khomeini, to build an army, pushed annual population growth to a peak of 4.2% in the early 1980s. This enormous growth began to burden the economy and the environment. The country's leaders realized that overcrowding, environmental degradation, and unemployment were undermining Iran's future. Iran's dramatic reduction of birth rate. 1989, the government did an about-face and restored its family planning program. 1993, a national family planning law was passed. Iran Broadcasting was given responsibility for raising awareness of population issues and of the availability of family planning services. Some 15,000 health houses or clinics were established to provide rural populations with health and family planning services. Iran's dramatic reduction of birth rate. Religious leaders were directly involved in what amounted to a crusade for smaller families. Iran introduced a full panoply of contraceptive measures, including the option of male sterilization, a first among Muslim countries. All forms of birth control, including contraceptives such as the pill and sterilization, were free of charge. The only country to require couples to take a class on modern contraception before receiving a marriage license. Iran's dramatic reduction of birth rate. A broad-based effort was launched to raise female literacy, boosting it from 25% in 1970 to more than 70% in 2000. Female school enrollment increased from 60 to 90%. Television was used to disseminate information on family planning throughout the country, taking advantage of the 70% of rural households with TV sets. Iran's dramatic reduction of birth rate. Family size in Iran dropped from 7 children to fewer than 3. From 1987 to 1994, Iran cut its population growth rate by half. Its overall population growth rate of 1.3% in 2006 is only slightly higher than the US growth rate. Soap operas on radio and television can even more quickly change people's attitudes about reproductive health, gender equity, family size, and environmental protection than formal education. A well-written soap opera can have a profound short-term effect on population growth. It costs relatively little and can proceed even while formal educational systems are being expanded. Pioneered by Televise, Mexico's national television network, series of soap opera segments on illiteracy. The day after one of the characters in his soap opera visited a literacy office wanting to learn how to read and write, 250,000 people showed up at these offices in Mexico City. Eventually 840,000 Mexicans enrolled in literacy courses after watching the series. Subsidies dealt with contraception in a soap opera entitled Accompanyme, which translates as Come With Me. Over the span of a decade, this drama series helped reduce Mexico's birth rate by 34%. Ethiopia. These last 15 years, their radio serial dramas broadcast in Amharic and Oromo have addressed issues of reproductive health and gender equity, such as HIV/AIDS, family planning, and the education of girls. 2 years after the broadcasts began in 2002, 63% of new clients seeking reproductive health care at Ethiopia's 48 service centers reported listening to one of PMC's dramas. Ethiopia. 55% increase in those who had used family planning methods. Male listeners sought HIV tests at a rate 4 times that of non-listeners. Female listeners were tested at 3 times the rate of female non-listeners. Average number of children born per woman dropped from 5.4 to 4.3, a 1/5 reduction. Demand for contraceptives increased 157%. Using Iran and Ethiopia as models, expanding these services to reach all women in the developing countries would take close to $17 billion in additional funding from both industrial and developing countries. The costs to society of not filling the family planning gap may be greater than we can afford. Smaller families brings generous economic dividends. Bangladesh. Analysts concluded that $62 spent by the government to prevent an unwanted birth saved $615 in expenditures on other social services, a 900%, tenfold return. Reproductive health and family planning services leaves more fiscal resources per child for education and healthcare, thus accelerating the escape from poverty $7.9 billion gap. Better health for all. In developing countries, infectious diseases are the overriding health concern. AIDS, the principal diseases of concern. Others are diarrhea, respiratory illnesses, tuberculosis, malaria, and measles. Child mortality is high. MDG of reducing child mortality 2/3 by 2015 is lagging badly. As of 2005, only 32 of 147 developing countries are on track to reach this goal. In 23 countries, child mortality has either remained unchanged or risen. Only 2 of the World Bank's 35 fragile states are on track to meet this goal by 2015. Dry compost toilets. 1.1 billion people lack safe and reliable water. Water-free waste disposal systems that do not disperse disease pathogens. Dry compost toilets. They help alleviate water scarcity, reduce the dissemination of disease agents in water systems, and help close the nutrient cycle gap. Oral rehydration solution. If they know, one can treat diarrhea at home by simply adding salt and sugar to water. BRAC succeeded in dramatically reducing infant and child deaths from diarrhea in a country that was densely populated, poverty-stricken, and poorly educated. UNICEF used BRAC's model for its worldwide diarrheal disease treatment program. Egypt alone used oral rehydration therapy to cut infant deaths from diarrhea by 82% from 1982 to 1989. Stellar achievement. Eradication of smallpox required a worldwide immunization program. Saves not only millions of lives, saves hundreds of millions of dollars each year in smallpox vaccination programs. Saves billions of dollars in healthcare expenditures. Near eradication of guinea worm disease. Former US President Jimmy Carter and the Carter Center. Worms, whose larvae are ingested by drinking unfiltered water from lakes and rivers, mature in a person's body, sometimes reaching more than 2 feet in length, and then exit slowly through the skin in a very painful and debilitating ordeal that can last several weeks. Eradication depends on filtering drinking water to prevent larvae ingestion. The number of people infected by the worm has been reduced from 3.5 million in 1986 to 25,217 cases in 2006, an astounding drop of 99%. Premature deaths are lifestyle related, such as smoking. 5.4 million people died in 2005 of tobacco-related illnesses, more than from any single infectious disease. Way to go, US corporations. Today there are some 25 known health threats that are linked to tobacco use, including heart disease, stroke, respiratory illness, many forms of cancer, and male impotence. Cigarette smoke kills more people each year than all other air pollutants combined, more than 5 million versus 3 million. Progress is being made in reducing cigarette smoking. WHO''s tobacco-free initiative. Framework Convention on Tobacco Control, first international accord to deal entirely with a health issue. Adopted unanimously in Geneva in May 2003. Treaty calls for raising taxes on cigarettes, limiting smoking in public places, and strong health warnings on cigarette packages. United States now leading away from smoking. Average number of cigarettes smoked per person in US has dropped from its peak of 2,814 in 1976 to 1,225 in 2006, a decline of 56%. Worldwide, usage has dropped from the historical high of 1,027 cigarettes smoked per person in 1988 to 859 in 2004, a fall of 16%. Media coverage of the health effects of smoking, mandatory health warnings on cigarette packs, and sharp increases in cigarette sales taxes have all contributed to the steady decline. Countries have taken strong steps. Ireland imposed a nationwide ban on smoking in workplaces, bars, and restaurants. India banned smoking in public places. Norway and New Zealand banned smoking in bars and restaurants, and Scotland banned smoking in public buildings. Bhutan, a small Himalayan country sandwiched between India and China, has prohibited tobacco sales entirely. Protection of non-smokers. In 2005, smoking was banned in public places in Bangladesh, and Italy banned it in all enclosed public spaces, including bars and restaurants. More recently, England has forbidden it in workplaces and enclosed public spaces, and France is phasing in a similar ban by 2008. US actions against smoking. Union Pacific Corporation stopped hiring smokers in 7 states as an economy measure to cut healthcare costs. General Mills imposes a $20 a month surcharge on health insurance premiums for employees who smoke. Each of these measures helps the market to more accurately reflect the cost of smoking. Economic benefits of healthcare. Village-level clinic would yield enormous economic benefits for developing countries and for the world as a whole. Providing basic universal health care in developing countries will require donor grants totaling $27 billion in 2007, scaled up to $38 billion in 2015, or an average of $33 billion per year. In addition to basic services, this $33 billion includes funding for the Global Fund to fight AIDS, tuberculosis, and malaria and for universal childhood vaccinations. Curbing the HIV epidemic. 4.3 million people were newly infected in 2006. More than 40 million have died from AIDS thus far. 2/3 of them in Africa, the epicenter of the disease. Key to curbing the AIDS epidemic, education about prevention. Governments are beginning to design effective prevention education programs. The first goal is to reduce quickly the number of new infections. Concentrating on the groups in a society that are most likely to spread the disease is particularly effective: truck drivers, sex workers, soldiers, drug users. Condoms. Dealing with the HIV threat requires roughly 13.1 billion condoms a year in the developing world and Eastern Europe. Including those needed for contraception adds another 4.4 billion. But of the 17.5 billion condoms needed, only 1.8 billion are being distributed, leaving a shortfall of 15.7 billion. At only 3.5 each, or $550 million, the cost of saved lives by supplying condoms is minuscule. If we assume that logistics, training, education, etc. costs are 6 times the price of the condoms themselves, filling this gap would still cost only $3 billion. AIDS financial resources and medical. Severely limited compared with the need. 4.6 million people who exhibited symptoms of AIDS in sub-Saharan Africa in 2006. Just over 1 million were receiving the antiretroviral drug treatment that is widely available in industrial countries. Just 25%, a 75% shortfall. Deathfall. The prospect of treatment encourages people to get tested for HIV and raises awareness and understanding of the disease and how it is transmitted. AIDS treatment is the humanitarian and economic thing to do. Treatment extends life. The average extension in the United States is about 15 years. Once society has invested in the rearing, education, and on-job training of individuals, the value of extending their working lifetime is high. Reducing farm subsidies and debt. Eradicating poverty involves much more than international aid programs. Reform of farm subsidies and aid-giving countries and debt relief may be even more important. A successful export-oriented farm sector often offers a path out of poverty. For many developing countries, this path is blocked by the self-serving farm subsidies of affluent countries. Industrial country farm subsidies of $280 billion are roughly 2.5 times the development assistance flows from these governments. Western country farm subsidies. In 2005, the EU25 accounted for $134 billion of the $280 billion spent by affluent countries on farm subsidies, about 47%. 47%. EU. The United States spent $43 billion on farm subsidies, about 15% of the total. These encourage overproduction of farm commodities, which then are sent abroad with another boost from export subsidies. Result is depressed world market prices, particularly for cotton, one of the commodities where developing countries have the most to lose. EU accounts for more than half of the $104 billion in development assistance from all countries. Much of the economic gain from this assistance in the past was offset by the EU's annual dumping of some 6 million tons of sugar on the world market. Sugar is one farm commodity where developing countries have a strong comparative advantage they should be permitted to capitalize on. 2005, the EU announced that it would reduce its sugar support price to farmers by 40%, thus discouraging the excess production that lowered the world market price. The affluent world can no longer afford farm policies that permanently trap millions in poverty by cutting off their main avenue of escape. Sugar price rise may help developing countries. Rising oil prices appear to be increasing sugar prices as more and more sugarcane-based ethanol refineries are built. The price of sugar may start to track the price of oil upward. Where nearly all the world's cane sugar is produced, developing countries. Debt forgiveness, another essential component of the broader effort to eradicate poverty. Sub-Saharan Africa spending 4 times as much on debt servicing as it spends on health care. Debt forgiveness can help boost living standards in this last major bastion of poverty. Some debt relief has been granted. Zambia, the $6 billion of debt taken off the books enabled President Levy Mwanawasa to announce that basic health care would be now free. In Oxfam's words, the privilege of the few became the right of all. In East Africa, Burundi announced it would cancel school fees, permitting 300,000 children from poor families to enroll in school. In Nigeria, debt relief has been used to set up a poverty action fund, some of which will go to training thousands of new teachers. Additional countries need relief. There are at least 40 more countries with low incomes that desperately need help. A poverty eradication budget. A poverty eradication budget. Developing countries' governments often cannot cope. Rapid population growth for several decades produced signs of demographic fatigue. Countries struggling with the simultaneous challenge of educating growing numbers of children, creating jobs for swelling ranks of young job seekers, and dealing with the environmental effects of population growth are stretched to the limit. When a major new threat arises such as the HIV epidemic, help countries that want to slow their growth. This brings with it what economists call the demographic bonus. When countries move quickly to smaller families, growth in the number of young dependents, those who need nurturing and educating, declines relative to the number of working adults. In this situation, productivity surges, savings and investment climb, and economic growth accelerates. Japan, with others following, cut its population growth in half between 1951 and 1958, was one of the first countries to benefit from the demographic bonus. South Korea and Taiwan followed, and more recently China, Thailand, and Vietnam have benefited from earlier sharp reductions in birth rates. This effect lasts for only a few decades, usually enough to launch a country into the modern era. Except for a few oil-rich countries, no developing country has successfully modernized without slowing population growth. Steps needed to eradicate poverty. Accelerate the shift to smaller families. Filling several funding gaps. Reach universal primary education. Fight infectious diseases, such as AIDS, tuberculosis, and malaria. Provide reproductive health care. Contain the HIV epidemic. The initiatives discussed in this chapter are estimated to cost another $77 billion a year. Steps needed to eradicate poverty. Heaviest investments in this effort center on education and health, cornerstones of both human capital development and population stabilization. Education, universal primary education, and a global campaign to eradicate adult illiteracy. Healthcare includes the basic interventions to control infectious diseases, beginning with childhood vaccinations. For the first time in history, we have the technologies and financial resources to eradicate poverty. Helping low-income countries break out of the demographic trap is a highly profitable investment for the world's affluent nations, a way of reducing the number of failing states. Industrial country investments in education, health, and school lunches are in a sense a humanitarian response to the plight of the world's poorest countries. But more fundamentally, they are investments that will shape the world in which our children will live.